I am Manish Ranjan, CEO and founder of NanoHealth. We are solving the biggest health problem of our generation, the problem of non-communicable diseases like diabetes, hypertension. This is a very unique problem, and the solution got to be unique as well. I mean, just to get an estimate of, the kind of how big the problem is, it's around 2/3 of all the deaths today is happening because of non-communicable diseases. More and more people are suffering because of the lifestyle changes that is happening. The age, people are living longer and longer, and it's affecting more and more of them. Another thing very unique about these diseases are that they make you economically not feasible a long time before. So that effectively means that even before you actually die, you're become ineffective in many ways. Just another marker is like every 12 seconds someone dies out of heart attack in just in India. So I mean the extent of problem is as big. But what's very unique about these diseases are that they are asymptomatic. That means that there are no symptoms. So just like if you may have flu, then there will be fever and all, but these diseases have no symptoms. And the other thing is, like, unlike again flu, after a few days you get okay and you're 100% fine. But for these diseases you just can't get better. I mean, like, you can only manage them effectively. So our entire healthcare system at this point of time, which is reactive and fragmented, is just not suited to solve this problem of non-communicable diseases. And that's where was the birth of NanoHealth, to solve this specific problem. And we have been able to come up with a solution that can make the existing health system more proactive, coordinated, and continuous. The whole idea of NanoHealth emerged when me and my team members were studying healthcare management at Indian School of Business. While we were there, we were working on multiple ideas, and that's when and the whole, just like many different competitions within our business school, the challenge of HEALTH Prize came in. And HEALTH Prize is like the largest student competition in the world. Every year they come up with one specific problem which is affecting the mankind, our generation, the most, and then they expect all the students around the world to come up with a solution for that. That year the challenge was, how do you solve the problem of non-communicable diseases, and that too in urban slums, which makes it a lot more difficult. We participated in that, and we were actually the winner of that competition, the only winners so far. I mean, that was back in 2014.
And they selected a winner, a team from the Indian School of Business and their innovative concept, NanoHealth.
President Clinton gave us $1 million to solve this biggest problem of health problem of our generation. And and that's what we have been doing so far. And since then we have touched more than 80,000 lives. We have been able to show the impact that anyone who has actually used our solution, they have been able to reduce their blood pressure, blood sugar levels, and effectively they're extending the life of the people. And and then we are in the market, ready to serve. We are ready to scale it to in multiple business segments at this point of time. We are into work in 3 business segments. One is we work with large NGOs and governments who are providing the health and wellness center, the community health solution, and so on. So we provide technology and program management solutions for them. Like one of the programs we are doing is hypertension management for 100,000 people in Bihar. Similarly, we are working at Sirsila here for managing the entire health and wellness centers and the community health together in an integrated fashion. Our other offering is for the corporate health and wellness, where the wellness has been kind of proven that though important, has not given the required ROI, and that's where we come in with our disease management solution. And we have been able to show that not only the health of the employees improve, the employee engagement improves, but you are also able to reduce the health claims, so which is again very kind of just unheard of, and we have actually been able to prove it with the complete data. We also work with clinics and hospitals to improve their patient engagement, which is like once they reach out to the hospital and clinics, I think doctors does their best, but what happens after they have left the clinic and hospital, that's where again our solution comes in, which ensures that the continuity of care is maintained in a most proactive way possible. Today's healthcare system is just not ready to gear up with the challenge. I mean, they can fix a person with having heart attack and make them alive again, but they can't prevent the heart attack from coming, and that's where we come in. The whole healthcare system with the big hospitals, big clinics are absolutely, reactive and fragmented. So what happens to the patient, after they have left the premises of the clinic or hospital? Usually there are no connect after that, and that's where our solution comes in, which ensures that that continuum of care is maintained. It's a win-win for everyone. The health of the person or the patient improves because there is a continuity of care, and since they are using and utilizing more services, even the revenue for the clinic and hospitals increase. I think we are in this shift right now from so-called solving the problems of flu and heart attacks and accidents to something managing the whole idea of management of disease, which is not about providing the one-time pill for a week or month, but it's about how do you ensure that you are continuously connected with your patients. I think we are ready to kind of scale up now. Basically, our goal is to reach out to more than 15,000 people in the corporate segment in the year 2019. We also want to reach out to more than 100,000 people in the public or underserved people managing their health. I think the impact in terms of reduced blood pressure level or the health improvement for everyone to see. So yeah, we have big plans as we move forward from now, and we definitely seek all the support possible to make sure that that we are able to do it, and it actually directly impacts the health of the people that we work with. One thing I'll definitely like to mention is that CIE over here has been added a lot of value. It's not only about the space. I think the most important thing is just the energy that you see around, be with other startup founders or their team members, and all the support in terms of technical or operational or business development, business segments, that you can keep talking about them and learning from each other. And and that's where you kind of come in, and you don't the biggest thing that you can learn from others is that the mistake that they have made, you don't make the same mistake, and that can save a lot of time and money, where especially for startups where the resources and the time is always a constraint.